On today's Sunday show, joining me is George Cooper, who left Oxford University and variously studied herbalism in England and Australia, I think, and then went on to study traditional Chinese medicine, including a stint in China. So good morning, George. How are you?
Morning, Chris. I'm very good.
Very good. And where are you? In Bristol, aren't you?
I'm in Somerset, the promised land.
Somerset. Oh, that's a bit further down the road. Well, it's a great pleasure having you on the show. We haven't covered traditional Chinese medicine on any of the shows before, but as you know, I'm very, very interested in it. I did actually go to China once for a couple of weeks, and I had my tongue and eyes and everything looked at. It was quite an experience. All right, we've got lots of viewers' questions, about 18 or so for today, and we're going to try and run it at about 45 minutes to 60 minutes, which gives us a couple of minutes per question. So there's a very small question that kicks off today, which is, what is traditional Chinese medicine? It's from Sam Roberts.
Well, don't worry, because I can give you a very precise answer. So basically, in the first half of the 20th century, the situation in China was that there was traditional medicine, and the way it was practiced was really inherited or as an apprentice system. So there was variety, basically, quite a lot of variety between different practitioners. But the key was that it was based on 4 classical texts. So the sort of foundation of the medicine was common for all the practitioners, but there was a lot of variety in the way that they enacted it. And what happened when the communists came to power was that they did recognize the value of the medicine. And they basically enlisted a number of very famous doctors and academics to create a synthesis of the different traditional styles of medicine. And so what you ended up with was a common theory. So that common theory is founded on these 4 classical texts. And what it means is that you've got a common diagnostic system and a common treatment method, and a common materia medica and so on, a common systematization of acupuncture points, for example. And that really is what TCM is. So when I went to Westminster University for what was called an acupuncture with TCM degree. And then when I went to China after that, everything they said made sense to me because it's basically, you have a core curriculum with textbooks and so on, and they've been translated into English. And it's common throughout the world. That's what, when we're talking about TCM, we're talking about that system that was created by the communists.
Would you say, just out of my interest, I mean, would you say that still the vast majority of Chinese use traditional Chinese medicine, or is it swung, as the pendulum swung to drugs and vaccines and all that sort of stuff?
I think the reality is that it's the ratio of 4 to 1. So basically there are four allopathic doctors for every 1 traditional in China.
Really?
Yeah.
So it really has changed.
All Chinese, it remains the case that all Chinese doctors, whether they're allopathic or traditional, have to learn some traditional medicine. But they just, obviously, if you've decided you're going to be an allopathic doctor, then you just absolutely minimize the traditional content of your learning. And traditional doctors in China then are able to prescribe drugs, so they can operate as conventional doctors. But and there's a split between generations as well. Older people tend to go more down the traditional route. But I believe Chinese medicine is here to stay. I really believe that. I mean, the herbal side is a massive industry. And actually it underpins a lot of rural communities. You know, they have specialist herb growers in all the different provinces of China. It's incredibly important. And also, you know, the same reason I practice Chinese medicine is why people go for Chinese medicine in China. It's because it provides unique solutions. And, you know, as you know, a certain amount of allopathic medicine is based on good evidence, which means that it actually works. But there's a huge amount of smoke and mirrors. And it just leaves a lot of people who are looking for solutions to their health. And in that sense, traditional medicine is hugely valued in China. And I can't see why that would ever change.
Good, good. Second question, Beth Johnson. Why is it called traditional? Has it been standing still, or has it actually developed new treatments over the years?
So it's called traditional because you had to have a way of differentiating it from modern.
Okay.
I don't think it's any more complicated than that. It's just a name. But obviously traditional is a reference to the past. Even with younger Chinese, you know, this Confucian principle of honoring tradition is, I don't know whether you see it in Thailand as well, but it's exceptionally important. It's so deep, it's part of the Chinese identity.
Yes, yes.
So that's that. With reference to the fact moving forward is a slightly kind of nuanced phrase, but you know, I don't think, in one sense, it's stuck in the past, in that, you know, it's arisen from the world's greatest continuous written culture. We owe the Chinese a massive amount in cultural terms. You know, they have this kind of continuity in their culture, which is a phenomenal resource, I believe, for humankind. Which is not to suggest they're perfect; they do terrible things, but you know, this, especially their written culture and tradition, is something special.
Yeah.
And we see that in the medicine. But you know, let's understand the scale of traditional Chinese medicine across history. We were talking about how many doctors there are. Well, if it's 1/5 of doctors in China, they're servicing the equivalent of a population of 300 million people. You scale that up across the world, it's millions of doctors, and they're all doing slightly different things because they're individuals, and they're doing that over history. So yes, they're innovating. You know, I was thinking this morning, what sort of thing demonstrates that? Well, there are modern formulas, for example. Two of the most widely used formulas in Chinese medicine, Yin Chao San, Gan Mao Ling, antiviral formulas, are modern. We use electrostimulation in acupuncture. We've got heat lamps. In fact, the heat lamps I now use in my clinic are patio heaters.
Right.
They're just perfect.
Yeah.
You know, they just, if you position them right, they cover the treatment couch absolutely perfectly. Powder extracts. So they have ways now of processing herbs and concentrating the herbs for convenience, but also, although it's a raging debate, you know, there's the old school, but I'm a powder man. I haven't seen any difference in my results.
What's this is powder versus tincture, is it?
Tinctures. For tincture, read medicinal wine. So the Chinese have used tinctures forever, but they're steeping the herbs in wine. But actually, if you think about it, an extract in alcohol is pretty niche in medical terms. I mean, there are relatively few instances where that would be an optimum delivery mechanism for herbal medicine. But if you go to a traditional Chinese shop, you'll see them, all the medicinal wines lined up, and some of them are for drinking, and many of them are used as liniments and for external use. But the powder extract, but they take the raw herbs, they boil them up in a factory, they capture the essential oils that boil off. Then it's a bit like instant coffee. So they basically remove the water, and then you're left with a powder. These days, now they try to use the powdered herb itself as an excipient. So they put the extract back onto the powdered herb and then add in the oils. And the quality of that technology has improved massively in the last 40 years. We've got some really, really fantastic powders. I mean, I suspect your artemisinin extract that you sell, I can't remember what the name of the brand is, but that's basically must be that powder.
Yeah, we use artemisinin quite a lot.
Yeah. So basically that is Qinghao powder, and I've got that on my shelf in a bottle.
Yep.
You have it encapsulated, and I've got versions of that for about 400 herbs in my dispensary.
I've got a question from Richard Wood. He says, are the medicines in China all herbs, in TCM all herbs? Are
No,
they concentrated, and if so, how? Because you get this, you know, in Britain, for example, there's always this kind of, well, supplements aren't as concentrated as drugs, but then they still don't want you to use the supplements.
Yeah, I mean, you know, there's a psychology around this. I love that expression, boys count. So it's just like, you know, how potent is it? Well, actually, it doesn't really matter. What matters is whether it works.
Mm.
And actually, what we find with herbal medicine is that a huge number of herbal medicines work on the level of food.
Yes.
Actually, you need much more of them. But that's what you need to do to get the job done.
Yeah.
I mean, in terms of concentration, that's we've just discussed that. That's what they're doing with the powders.
Yeah. But
people are still amazed when I tell them, you know, the dose of a powder formula they have to take. They think it's a huge amount. But you know, I just say, well, it's herbal medicine. What do you expect?
Yeah, that's right.
You know, I could give you a tiny amount of an exceptionally poisonous chemical, but I'm not in that game.
Yeah, I get asked by patients. They say, you know, how much of this do I take? And I say, they almost seemed upset because I say, well, you take what says on the bottle, because all the different herbs have basically got different concentrations in the pills and in supplements. So I have no idea, without knowing what they're actually, which brand they're going to be taking or whatever. I don't know how concentrated it is half the time.
Well, there's an expression in Chinese medicine that dose is the secret that cannot be taught.
Oh, right. Okay.
So basically, it means how masterful you are. It's a brilliant expression. It doesn't matter how masterful you are as a practitioner, you cannot look at a person and determine the optimum dose of anything for them. It's just true. And so basically, if I'm seeing someone in the first instance, I just say, well, we've got to just give this a go. But, you know, I always apply the precautionary principle. And then, you know, skin is a good example. If there's a skin problem, then I might ramp it up. If we're not having the right impact, then I might ramp it up.
Actually, that's an interesting point about the precautionary principle. Have you ever seen artemisinin cause liver problems, jaundice?
No.
That's really interesting.
I have had doctors take a Qinghao artemisinin to Africa because they know that you know the drug resistance is very high. They know that's a waste of time. They know the toxicity. They'll just take that. In the Materia Medica for Qinghao, one of the things they say is how well tolerated it is.
Yeah. Now, I did actually have a rather rotund chap on Folfox, and he obviously had a bit of problem with his liver, and he got jaundice. Your Chris Woollams and his bloody artemisinin gave me jaundice, I think was his words to Wendy in the office. But in fact, it took me ages to find anything on the web, and I talked to a couple of top herbalists in Britain, and they said they'd never heard of it. So
I mean, you do worry, but I think one of the things you get with experience as a herbalist, and I've been doing it for 20 years, is you just know whether it's you or not.
Yeah.
And you know, actually the toxicity profiles of these herbs are pretty good. So you can look up a modern Materia Medica and draw down a really good toxicity profile on any herb. And you know, we're using Qinghao for liver problems. You know, I mean, think of malaria. Think about the way malaria affects the liver.
Yeah.
You know, it's remedial.
Yeah.
So, you know, I'm not going to comment on individual cases, but I can say that, you know, I am now at the point with my experience where if people come in and, you know, there's concern about what I'm doing, I'm pretty relaxed. You know, I can sort it out and discern cause and effect and so on pretty quickly. I mean, we're limited for time, but you know, in fact, normally when something like that happens, it's a red flag. You know that there's something they haven't told you.
That's right. There's something else going on. I agree.
Something else going on. A classic thing. My marriage is in trouble. My father died last year. Why didn't you tell me?
Yeah, yeah, I agree.
Stuff that's burning them up. In his case, I don't know, but he might have an alcohol problem. He hasn't told you, or he's taking a particular drug, or you know, he's got massive levels of trans fats in his diet. You know, this is the sort of thing that you just don't know. And you, in the way that you work, there's a certain vulnerability to that because you're so stretched and you're just trying to give as much as you possibly can. Time is at a real premium. And there's just not as much time as any of us would like to get to know people. And in clinical terms, that can be that can cause these difficult situations.
Yeah, I agree with you, but I built a system over the years. I basically only do one patient a day. I can't do more than that, which sounds, well, I'm doing it as a, I'm going to say hobby, but I am doing it as a hobby, really. It's my spare time. And so I make people fill in a form, and it's quite extensive. And what they don't realize is question 1 goes with question 8, and which goes with question 15. So it's kind of hidden. And I build up quite a picture of people before they ever come near me. It's 2 hours. A PP is 2 hours.
I'm a huge fan of what you do and how you work. So please don't.
No. I was just saying I agree with you, is what I'm saying. I agree with you. You've got to understand them.
The issue is just the complexity of the way that people present.
Yeah.
And, you know, I've had over the years people I've spent many, many hours with them. And then I just learned something crucial about them. You know, 2 years later,
before.
Identical twins. And I just, for the life of me, I just couldn't work out why they both just suddenly become so ill. And I treated them both. And then 2 years later, they both told me that their father had died really horribly traumatically of cancer. And for some reason, both of them hadn't chosen to tell me. You know,
yeah,
and
but people do keep things like that.
A huge.
Well, now you mentioned the word cancer. Deborah Wilson says, what is the traditional Chinese medical view of cancer?
Okay, well, I have, this is in one of the articles I've written for you.
Yeah.
So they can follow it up. It's in the herbal medicine article. But basically, the tumor itself, the cancer, is sort of classified in 4 different ways. So basically, and this is the characteristics of the tumor, how it presents. So it can be a blood stasis, phlegm, fire poison, or qi stagnation. But it's really important to understand that a tumor can have characteristics of more than one of them. A real classic, qi stagnation leads to blood stasis and phlegm accumulation that then causes fire poison. You know, that's breast cancer. You know the relationship between breast cancer and stress. So it's this thing where, you know, if you women premenstrually get sore boobs and, you know, all this stuff where the qi just isn't flowing, so you get circulation issues. And so, and you're the expert on all the sort of biochemical mechanisms that are taking place with all that. But this is why it's very important with TCM and cancer that you get a really good diagnosis from a practitioner, because it's a technical matter, and you just have to know on that technical basis what's going on, because the actions of the herbs are very specific, and you know the way that Chinese medicine works is that you start with a diagnosis, and then the diagnosis leads to a treatment principle, and the treatment principle leads to the choice of the herbs. And you know, when we're training in the West, when you're training in Chinese medicine, there's this phrase that keeps cropping up: what are the herbs for irritable bowel? What are the herbs for inflammatory bowel disease? What are the herbs for ME? No, 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 no. That's not how it works. What are the herbs for the TCM diagnosis of your patient? So it's psychologically, it's a completely TCM is the preeminent medicine of the individual.
Yeah.
And this is what makes it so effective, because you have this incredible diagnostic system which is so versatile, so universal. And we'll get on to COVID in a moment, but it has meant that as a practitioner, people can come in with a brand new disease and you can hit the ground running.
Yeah.
Because you have a system, you can diagnose them as individuals. So that's the excess side of cancer. And underlying in the vast majority of individuals, all adults, there are what we call underlying deficiencies. So deficiencies of qi, blood, yin and yang. And we've got questions down the line about the immune system and so on. And so understanding the deficiency of a person is exceptionally important. And people who've had cancer treatment, allopathic cancer treatment, the treatment creates deficiencies.
Yeah. It's very interesting you talking about this, because the very first copy of everything you need to know to help beat cancer went on and on about deficiency. I said it, almost everybody I ever talk to who's got cancer is deficient. It could be nutritionally deficient, or they're deficient in some sort of psychology, stress or whatever, So I agree with you totally.
In Britain, the Victorians talked a lot about constitution, and we still had a sense of it moving through the early 20th century. A child could be prescribed malt, as a tonic. But with the development of the pharmaceutical culture, our understanding of deficiency has been completely removed from our culture. There is no pharmaceutical drug that makes you stronger. And if a drug doesn't make you stronger, then the concept of weakness doesn't exist. It's as simple as that. Whereas we've kept in the Chinese medicine, I would argue really that the tonics, the herbal tonics in Chinese medicine it's enormous strength. It's very great strength. Obviously, they have to be combined with everything else, but it's the herbal tonics in my practice which mean that I can just roll up my sleeves and knuckle down with someone and over a period of time really transform their health. And again, we'll see that
what you do and I do is much the same then, because I generally believe, as you've probably heard, that people have built a body conducive to cancer over a 6 to 10 year period, and what I try and do is build them a body conducive to health. I actually almost forget about the cancer. I'm trying to build them a really strong, healthy body, and the cancer sort of tends to have a hard job surviving in there.
The issue, Chris, is cultural. So I'm standing on the shoulders of giants. So I've got this incredible system of medicine that I'm employing, which has evolved over 5,000 years.
Yeah.
What you're doing is you're at the very beginning stage of inventing the Western equivalent. You're part of this group of people who are trying to create an effective system. And the problem is, we can go back to the Middle Ages when they burnt the witches. It's this sort of tragedy that most of these witches were herbalists. And they were not literate. So this is the big difference, is that in China they wrote everything down, and in the imperial there was no conflict with institutional medicine and religion in China in relation to the traditional medicine. So it was embraced, especially in the imperial court. It was all written down, it evolved, it was nurtured. Whereas we destroyed, I say we, but in the West, in Europe, it was destroyed.
Well, this is kind of feeling it's inferior in some way, isn't it?
Well, it's just can be considered to be quite sort of amusing, actually. If you talk to you know, a huge number of doctors, or, you know, it's just can be considered to be a hobby. You know, I'm telling you, Chris, in my practice, I have saved lives. I have, you know, I'm not sure what the law allows me to say, but you know, I have resolved a huge number of exceptionally serious illnesses. You know, it's the real deal.
Yes.
And but what basically Western herbalism and the supplement industry and so on are attempting to do now, and in your case very effectively, is to recreate the medicine, this incredibly kind of potent medicine that understands, that is rooted, for example, in terrain theory. So to understand that to deal with an infection, a person has to be strong.
Yes.
That cancer, as much as anything, is a disease of the immunity. So to resolve cancer, you have to have a strong immune system.
Yes, absolutely.
And all of the complication that's entailed in that, and creating a theory. You know, science is a blunt tool. There's an expression in psychiatry that, you know, if our brain was complex enough for us to understand our brain, we'd be too. Hang on, what is it? Yeah, if the brain was simple enough for us to understand it, we'd be too stupid to understand it.
Yeah, yes, that's right.
And just what you essentially what you discover with any scientific study is an individual data point of knowledge, if you like. And then how do you integrate all of that knowledge to create an effective system? This, by the way, is what's so wonderful about our evolving understanding of the biome, because it draws so many of the strings together in a way that we can understand. But that's basically what you've got your shoulder to the wheel.
Yeah.
And you know, you're trying to integrate all these things in a really
I believe you build people from the gut out. You build their health from the gut out. And it's not really my idea. There was this chap called Hippocrates about 2,500 years ago who said that. So I think he probably got it right.
Well, I mean, that's a question later on, but we could address that now if you want.
Well, let's keep it in some sort of order. Patricia Evans, she says, we're talking about an actual herb now. Chris used honocchial from magnolia plant for me to stop metastasis, and it worked. Why does it work? What can I take to stop my lung cancer spreading? Are there other herbs that can help?
Okay, so what I'm not going to do is talk about chemicals, because that's your strength. But so honocchial is from magnolia bark, which is hopo, Chinese name, and it's highly aromatic. So what it does in Chinese medicine is it moves the qi. So it's dealing with that diagnosis of qi stagnation, and it removes damp or helps to resolve phlegm. So it removes that with that aspect of cancer diagnosis. So really, honocchial is probably most effective when you're dealing with tumors with those two characteristics.
With dozy characteristics.
Those two characteristics, where you've got stagnation and phlegm involved, then is effective. I think she said, was it lung cancer, she said?
Yes. Funnily enough, it's how I started using honocchial. Years ago, I saw some research on lung cancer, and it stopped it spreading. And I've just assimilated more and more research into one long article now. So
I mean, it's sort of self-evident that phlegm is very often involved in lung pathology. There's a wonderful expression in Chinese medicine that the guts generate phlegm and the lungs store it.
Okay. Anything else? Is there another one?
Say that again.
Is there another herb or two, or are there another herb or two that are like honocchial?
This is where it becomes difficult, because you know we're dealing with an individual case.
Yes.
And what we need is a diagnosis. So in cases like this, I always recommend you've got to go and see a good practitioner.
Yep.
And they will, you know, at that point it all opens up for you, because the Chinese Materia Medica's got 5,000 entries in it. you know, I've got 400 on my shelf. If I need something obscure, I'll get it in. But, you know, you've got a lot of options. The point about hinokiol, it's been focused, it's been concentrated. The compound itself is highly aromatic. So that's how it's working.
Okay. I've got one from Bob Jones. He often asks questions. What should I be taking for prostate cancer? I don't want drugs. So that's one of the pet hate sort of questions then.
It's a good question, which I really can't answer. So basically, I think there was a very famous formula, PC-Spez. Do you remember that?
Yeah.
It got trashed, but it also had it's also very popular. You know, I've got a book with the list, the composition of PC-Spez, but what I would do as a practitioner is get Bob in, do a diagnosis, and make him a much better formula than that.
Yeah, yeah.
So it is with all these formulas, and you mentioned Myomin. You know, what the formulas like Myomin and like PC-Spez, they're like signposts. They're like signposts of what you can achieve in a crude sense with Chinese medicine and cancer. But what you do, then is you get the patient in and do a really good diagnosis, and then you write a much more accurate formula. And you know that formula will change over time as well, according to the needs of the patient.
Yeah, Myomin, we ought to just tell people, Myomin was an oncologist, I think, in Chicago, who got fed up with women coming to him saying, I'm taking letrozole and astrazole, I'm getting hot flushes and bone pains. What's the alternative? And he got fed up with that. And he was half Chinese. So he put 5 Chinese herbs together, things like white curcumin, I seem to remember. And I've researched it. 2 are very good herbs, 2 are good. I can't find any research on the 5th, but I'm not Chinese. And it seems to have a cult following in America, Myomin.
What Myomin, what he's done is he's got a clear fire toxin herb in there. He's got a clear damp and phlegm herb, a move chi herb, and a move blood herb. So he's covered the 4 bases, and then he's got chi, which is the chi tonic. Okay.
All right. Well, we do suggest it to people. I've got some lady in America who's doing terribly well on it. This is D. Ford's, and he sent a picture. I will describe the picture. He said, I have a non-healing wound on my back near my spine, a hole which is red around the edges. This was quite staggering. It's actually about this big.
Yeah.
And it's circular, and it's got a raised skin all the way around it. Anyway, Western medicine can do nothing for me. And he said, is there any chance that traditional Chinese medicine can help?
Its characteristic is a bit like an ulcer.
Yes, it's an ulcer without anything nasty going on in the middle of it, by the looks of it. Just looks like it's yes, I definitely, it's got something going on there.
It would be very interesting to know his background, because you know, normally when this sort of thing happens, someone's just too weak to heal. So you want to do some internal work, but you can resolve stuff like this. It's normally pretty straightforward. So traditionally, what's used for non-healing ulcers is actually cuttlefish bone. So they get the cuttlefish bone off the beach, grind it up and put it on. I'm not suggesting that he does that, but there are other options. I know that you've used probiotics.
Yes.
There's a herb called Nota ginseng, a really brilliant healing herb called Nota ginseng, San Chi or Tian Chi. And I just wonder, I mean, you could use that San Chi on its own on that wound. And I wonder whether it would give it extra potency, adding a probiotic to the San Chi.
Yeah, I had a lady in the EU, and we'd rebuilt her, and she gave me a brief, and she said, I want to stay alive to do Brexit. Seriously, she's grade 4, stage 4. And I've talked to her only recently. So she's done it and she's now 5 years down the line. But she's rebuilt everything inside her. And she had still an ulcer just below the knee. And we've been chatting about it. And I said that once I'd healed my own cut in my mouth by putting a probiotic on it. And so when they offered her antibiotics, she said, no, I'm going to do the opposite. And she put probiotics and she said it literally cleared up in, within an hour, the red started going down. Within 2 days, it had pretty well cleared up.
Yeah.
But, that's...
There's other things internally, as part of his formula, he would almost certainly have astragalus, Huang Qi. So one of the classical indications of astragalus is rebuilding, it says generates flesh. And there are other flesh generating herbs. And then the other thing he should really consider is you can use acupuncture with electrical stimulation, because the reason typically that these wounds persist is because the blood circulation is very poor.
Yes.
So the white blood cells just can't get there. So what you do is you put a needle either side of the wound and run electric current through it, and it pushes blood in. And so you get an infusion of white blood cells. And that can really help to clear it up quite quickly. And if you can't get to an acupuncturist, you use a TENS machine.
Yes.
In my view, TENS machine is one of the most underrated devices in medicine.
Yeah.
I can't understand why it's ignored. For surgery, just put the pads either side of a wound every day. Just amazing. Just think how much surgery goes on. TENS machines have the most incredible potential. And they're basically working along the same principle as acupuncture.
Yeah. Yeah, I've got a TENS machine. I use it. Excellent.
Yeah.
Excellent. All right. Anita Evans said, did traditional Chinese medicine have a cure for COVID?
Well, what happened was that, the Chinese had COVID for longer than us. Actually, probably not that much longer than we might think. But nobody talks about that now. But in about May last year, a document came out from China that was a state-sponsored document, which was written on the treatment of COVID with traditional Chinese medicine, and it was really good. And the formulas in it have been very effective. And the problem is that Chinese research is absolutely unreliable. So the numbers that we've got relating to those formulas, are pretty meaningless. But I'm pretty sure that if you use those formulas in the hospital setting, they would be very, very helpful indeed.
Have you had to treat anybody with COVID?
Yeah. But it's not a concern. It tends to come. They've tended to come to me at a later stage. I mean, the characteristic of COVID is that you get this in a small number of cases. You get this the cytokine storm and so on, and it's pretty scary stuff.
Yeah.
Obviously, I haven't seen that. That all happens in the hospital. But anyone who gets through that, or anyone who has a lesser severity of symptoms, they come to me. It's not a problem.
Oh, I get quite a few people lately with long COVID. Have you got ways of dealing with long COVID?
There's a guy called Tim Spector who runs something called the Zoe app in the UK, and he's got a handle on the numbers. And actually, he said that long COVID isn't as common as is suggested. I've seen long COVID. It's pretty conventional post-viral stuff and comfortably dealt with.
Really?
Yeah.
Okay.
I mean, it's not worse than a severe flu, for example, in terms of the implications of treating it. Again,
though, is there a treatment package for it, or is it different by different people?
Absolutely different by different people.
I thought you said that.
It's just down to the diagnosis again. It's just like, you have to understand, why have they got long COVID? well, it's because they're weak. And so, the value of the diagnosis is understanding what the original weakness was,
why they're weak,
the persistent symptoms to remain. And then once you've got that, then normally it's pretty straightforward.
Okay, I've got a question by Barry Dwyer, who says Western medicine has typically had a one-size-fits-all myopia with cancer. How does TCM differ? I think you've probably answered that already, but
I think I have. It's down to the individual diagnosis. I mean, I think I wrote it in one of the articles on your website. Is why is it that these oncologists, they just throw the same treatment at a range of people for ostensibly the same cancer, and they get different results?
Yeah.
Well, we can analyze that using a TCM perspective. It's because it's different cancer. It might nominally be a lung cancer or whatever, but one individual, it might have a high characteristic of blood stasis with a strong underlying yin deficiency or whatever it is. With the chi stagnation, people more impacted by stress and so on.
Well, I would back that all the way, because I've been watching this guy, Dr. William Lai, L-I, I'm not too sure how you pronounce it, Lee or Lai. And he's a doctor in America who's invented 8 drugs and is famous for that. But he's now written a book about eat to beat illness. And he talked extensively all the time. There's a TED talk and a few other things on the localized microenvironment. And what we're finding that, as you know, over the last sort of 4 or 5 months, there's studies from Stanford and Sloan Kettering that there are no mutations in the DNA. You're not doomed. Something's going on outside, epigenetics, okay. And you've got to be right, because as soon as you start understanding epigenetics, changes are going on in the cytoplasm, the conversion of mRNA into proteins and so on. And we know that things like stress, localized low oxygen, gut bacteria, environmental toxins, all the things that cancer research say have got nothing to do with cancer, we know they must have an effect. And someone who's 85 or let's say 65 years old with prostate cancer, usually my people have got low oxygen. They're down in the 86s with prostate cancer. They don't do any exercise. But if someone had a cancer when they were 30, they probably have lots of oxygen around the outside of it. So that's not going to be a factor. So you then start looking for other factors. Would it be the same in traditional Chinese medicine?
Just because what we have with traditional Chinese medicine is that, issues of lifestyle are related to the diagnosis.
Yeah.
So, whether it's diet, whether it's stress, whether it's relationships, all these things have been analyzed in great detail. I think it's really important at this stage to stress that on Wikipedia, traditional Chinese medicine is defined as a pseudoscience. Well, they would say that. I don't pretend that anything that I do is scientific. It's medicine, but it's not scientific. And there's no point in pretending otherwise. Science is a system of testing, and that system of testing has never been employed in traditional Chinese medicine. And so, that's the value. The value is in the difference. And what we're trying to do, it's great fun, and it can have great practical value. Finding the common ground is hard work as well.
Are the numbers of practitioners going up in the UK, or are they going down, do you think?
It's a real worry. I was thinking about that this morning. It's a real worry. People listening to this thinking, I can see that I should go and see someone because they might be able to help me. And the problem is that that herbal medicine is just under relentless pressure. And the way that the European herbal medicines law has changed dramatically in the last 10 years. And we actually, ironically, if there was one good reason to vote for Brexit, it was European herbal medicines law. in the hope that the UK government might do something different.
Yeah.
Well, they haven't. It's a real concern. We're under this very kind of insidious pressure, and it has affected people's choices to train in as Chinese medical herbalists, because at the end of the day, they've got to make a living.
Yes.
There's this pressure, and I would say, that there's this. Well, you know what it's like when you've got an Oxford degree. You have a lot of choices, and I do, to a large extent, do this job for the love of doing it. And there's a band of us like that, but there are simply not enough of us by a long margin, because the potential of the medicine is just so vast.
You've actually hit a nail on the head. You said you do it for the love of doing it. And I tell people exactly the same thing. I do PPs because I really enjoy doing them. And you would not understand this. When someone comes back to you, I had 15 follow-ups in 3 weeks. I do a full one, and I do a follow-up every day. And out of 15 follow-ups, 14 people, I said, how are you? I'm fine. I've never felt better in my life. And it's great. It's fantastic when someone says that, and you just think, yeah, that's why I do it. I'm very happy to do it, and so on. And I just wonder if that's why I get so many patients who complain about oncologists and nurses in hospital now. It just seems to be all gloom and doom. Perhaps it's COVID or something, I don't know. But I actually did a speech to about 130 oncologists, and I said, I really don't know who teaches you your bedside manners, because they're not very good, And I just wonder if they sort of don't enjoy their jobs.
Well, Chris, Cancer Active is a diamond in the rough. What you've created is a resource of integrity and honesty, and that is you at the end of your Sunday shows, you always ask people for 3 tips, and one of my 3 tips has to be find a source of wisdom and integrity. And that's exactly what Cancer Active is. People can be honest with you.
Yeah.
And what you're doing with Cancer Active is you've created a new type of awareness. And it's a very diverse resource that you've created to build that awareness. And so, of course, they can have this kind of opinion now. It's
my fault.
Medicine is frighteningly hierarchical.
Yeah.
I can't. The psychological dominance of doctors is quite remarkable.
Yeah.
I can have a really good relationship with a long-term patient, and we can discuss, and they're absolutely on message, and then they will just go and do something breathtakingly ill-advised on the advice of their doctor. Actually, I said that what I do is not scientific. I do have 2 science degrees, and when I have these kind of conversations, it is based on science.
Yeah.
About what their doctor might do. So I'm talking about research, and I'm talking about good scientific clinical principles. It's not herbal medicine I'm doing.
Yeah. Well, I'm not a doctor. I never say I'm a doctor, but I'm a biochemist, so I know why things work behind it. The thing that upsets me in the recent months, about 6 months now, is Macmillan nurses, because Macmillan nurses were always wonderful. They liked Cancer Active. We used to send individual nurses the magazine so they could read it and talk to their patients and help them and so on. But the number of people now who are about to take a drug and they are told by the Macmillan nurse that, well, there's not enough research on these supplements, so while you're having the drugs, I think it's better if you just don't take them. I mean, where's that come from?
Well, I feel I'm slightly worried about the rabbit hole that we're going down.
Yeah.
Because the reality is a pretty grim reality, and there are some pretty dark forces that we're constantly up against, and that's it. Who's winning basically in terms of, you know, the understanding of the relative merit of the medicine. And what, you know, whether I'm at a wedding or this or that, it is unusual what I do, especially someone from my background. And it interests some people. Some people find it quite challenging.
Yeah. Well, I mean, Sarah Ferguson, I didn't notice it, but now I do. Sarah Ferguson asked the next question, which is, can I take traditional Chinese medicine herbs at the same time as my drugs? Taxol and carboplatin. Okay, so you must have ovarian.
Well, I suspect you know the answer to that question. The answer is yes. It's a qualified yes. It's again, we're saying go and see a practitioner, because, you know, it's the complexities of the individual case, but you can find good quality scientific research on combining Chinese herbs with chemotherapy, for example.
Right.
I have, as a practitioner, I have a clear understanding of interactions of herbs and drugs, and which drugs certain herbs are contraindicated. The big one is blood thinners.
Yeah.
Never combine a blood thinning herb with blood thinning drugs. Could be catastrophic. But there are other areas as well. So it's just making sure, and again, always applying that precautionary principle.
Exactly. It's what we're all about, precautionary principle. Sasha Huntley Palmer says, how does acupuncture help with cancer? I think more a question for you to answer. Does it hurt? Can it leave damaging marks?
Well, there's a variety of acupuncture practice. So if she went to China and she paid her 80 pence for an outpatient's appointment in the acupuncture department of the hospital, and they got out their reusable needles, which were about 0.5 millimeter thick, I don't think she'd ever go back. In my clinic, they're single use. I typically use a 0.2 mil needle. I've got very good needle technique, and I sort of specialize in helping people along who are very nervous about needles. Yeah. So it's not a problem. You can get sensations. The needles typically go between the nerves in the skin. So the majority of acupuncture is painless. If it catches a nerve, you get a characteristic sensation. You just take the needle out. Yeah. It really is as simple as that. You can rarely catch a small vein in the skin, so you would have some bleeding. It's a possibility, but it's not the case in the majority of cases.
Right. C. Bratchy, this is his email.
First half of our question very quickly. Acupuncture and cancer.
Yeah.
It's an enormous question.
Well, that's what I thought. Actually,
I would want to focus on the one thing is that the relationship between a practitioner and a cancer patient through acupuncture tends to be a wonderful relationship. You're meeting regularly. The patients very quickly really enjoy the experience. They enjoy the acupuncture. They enjoy the way they feel after the acupuncture. And the acupuncture becomes part of the problem-solving process. So I strongly recommend it.
We get a lot of people, especially women, who enjoy acupuncture for the relief of side effects when they're having their treatments, breast cancer and the drugs and things like that. So people speak very, very highly of it. Where was I? Yeah, C. Bratchy said, Western medicine is rarely concerned with prevention. How does TCM approach prevention, especially with young people? I shortened his question down.
Well, prevention is a choice. I mean, there is this possibly apocryphal tale how the Chinese doctor was only paid as long as his patients were well. I think that's probably not true, but the truth is that, you know, at the core of Chinese medicine is understanding how to stay well and how to be well. So you can use Chinese medicine as your primary tool to be well. You can use it to teach you how to eat. You can use it to teach you how to exercise, how to sleep. All of these things can be interpreted through the framework of traditional Chinese medicine. Talk about blue zones. What sits at the heart of Okinawan longevity? Chinese medicine. Absolutely. The way they exercise, the way they eat, even the way they think. The Chinese have a concept called yang sheng, and yang sheng is basically healthy. This is a highly evolved, very detailed, very sophisticated way of life for health. So that's the way that you would approach prevention. I thought about this. So off the top of my head, for example, if you were really concerned about cancer and you wanted to take some real kind of almost like soundbite elements, and anti-cancer approaches, mushrooms. On average in Asia, they eat 20 times by weight more mushrooms than we do.
Tell me about it.
Seaweed. So kelp, for example, is an anti-cancer herb. Green tea, of course, you know about. You must know about ren. Do you know about ren? It's a Job's tears, a type of barley, very commonly eaten as a food in southern China. They've got much lower cancer rates where they eat it. Coix, Latin name is Coix, Seaman Coix, C-O-I-X. And I'm a big fan of bone broths. I know they don't necessarily always apply during treatment or whatever, but I think bone broths are exceptionally potent. And of course, you can use bone broths as, so that noise, I think, let me just get rid of that noise.
You or is it me? I thought it was me, actually. I'm deaf, so I can't, and I've got one hearing aid, so I don't know where any noise is coming from.
Okay, I've got rid of it now. You know, you can take a bone broth and you can throw in your seaweed and your mushrooms and your pearl barley, and if you did that every day, ginger, of course.
Yeah, huge.
Ginger's huge. I rate ginger over turmeric, by the way.
So do I.
I've got three there. On my shelf, I've got 3 different types of turmeric as herbal medicines. The white turmeric you mentioned earlier, and then there's another type of turmeric called Yujin, and then there's Zhanghuang, which is the culinary turmeric. I never use the Zhanghuang. So it's actually the other 2 types of turmeric that I use and use a lot. But ginger, ginger in traditional Chinese is called women's ginseng. It's very, very highly rated herb. And Confucian, the 5th Confucian analect, in virtuous life, ginger is eaten every day. So
well, yeah, I mean, you come to Thailand and ginger in one form or another is eaten every day. So, you know, there's several sister brands or sister compounds, but I always use ginger. I suggest that people make a pint of natural green juices for glutathione, but I always tell them to put no fruit in it, but I tell them to put lots of ginger, 5 to 10 grams of ginger in it, because it just does everything from cut blood sugar to cut cholesterol to control inflammation, attack microbes, you know, you name it.
The point about the green juices is that they're, in Chinese medicine, we say they're very cooling, which is obviously the benefit when you've got the heat toxin.
Yep.
But digestion's a warm process, so you have to have the ginger. So a lot of the tannins and the acids in the green juices are very astringent in the stomach, and so you have to have a warm aromatic component to counteract that. So it's like the sweet and sour sauce. You've got the astringency, but then you've got the expanding aromatic to stimulate the gut motility. Otherwise, you just find people get terrible stomach aches. So the ginger is stimulating digestion to help with the juices.
Good. I'm getting it right. I'm getting something right.
Okay.
Right. Actually, you might have listened to the show. This is from Eve Shackleton. She said, we heard about Joy Parsons using Tai Chi to fight and beat triple negative breast cancer. Joy had all her treatments for about 1.5 years, wasn't doing very well. She was phase 3, stage 3. And she kind of followed me a lot and took up Tai Chi, and is now 17 years on, a Tai Chi instructress. What does Tai Chi really do for a patient with cancer?
Well, I do feel to a large extent that Joy answered that question. But what I would do is add the sort of Chinese medicine perspective.
Yeah.
The Tai Chi and the Qi, I think it's important to talk about Tai Chi and Qigong in the same breath.
Yes.
Qigong is very misunderstood. So Qigong in Chinese means Qi, discipline. It means working with Qi. What it really means is just exercise, but with an understanding of your Qi. And so the breadth of Tai Chi and Qigong is quite wide. And she did talk about the different traditions. But at their core, they have this understanding of the Qi and how it flows in the body. And the key thing to understand is that these systems are very, very efficient at stimulating the flow of Qi in the meridians. So meridians, we haven't talked about this. Meridians are a core concept in Chinese medicine that the vitality and the influences within bodies is concentrated into channels. And the acupuncture points are the most influential points on those channels. So you could stimulate them by pressing them. As it happens, the Chinese worked out the most efficient way to stimulate them is using a needle. So that's the foundation of acupuncture. But what the movements and postures in Tai Chi and Qigong achieve is stimulating the flow of Qi internally. And so, you know, the lung meridian runs along the forearm. So you get the stretches along the top of the forearm, and that will stimulate the lung meridian. For example, your digestive meridians run down the front of your legs. This is why squatting is so good for digestion, because you're stretching out your digestive meridians. It's very fascinating.
Well, of course, that's what Southeast Asians do. They squat.
I'll tell you, Chris, how important squatting is. If you were to do one stretch, if any individual was to do one stretch every day, it would be squatting. Because it treats your whole body. I mean, stretch out your back. You know, I mean, it's the abomination of our chair sitting culture.
Well, you're absolutely right. It's really funny because you get sort of situations out here in Thailand, and you know, we go somewhere and I'm looking for the chair in the corner, and my wife with the other ladies all kind of squat on the ground. They don't sit down at all. They just squat.
Chris, I feel like we've been victimized. We've grown up in schools. It's taken from us as very young children, this ability to squat. And it's a health resource, which is just so important. You know, I've been on the mountain. We went up, I don't know, Yellow Mountain in China. These steps, these endless steep steps. And you just see this old Chinese guy carrying a tree trunk up these steps. You know, this is a guy who squats for hours each day and he sleeps on a hard bed. No wonder his back's fine.
Yeah.
Anyway, these principles and Tai Chi, the point is that Tai Chi and Qigong are very sophisticated.
I don't know if you've heard this story before. I was in China and I was staying in a hotel and I kind of ran down in the morning. The river is right in front of us, but there's a big area between the hotel and the road. And as I ran down, I'm suddenly in about 120, 130 people in their 60s, 70s, 80s. It's freezing cold. It's December. It's 3 degrees below. And they've all got donkey jackets on and mufflers and caps. And they're all doing Tai Chi, literally all together, all 120, 130. It was a sight to behold.
Yeah, we're a long way off that happening in Somerset, I can tell you.
Well, then what, the -3 or the Tai Chi? Right, Mark Robinson, do the Chinese traditional medicine practitioners believe all illness starts in the gut, like Chris does. I'm not too sure I do, but
well, we've answered this question to a large degree, but the key thing to know is that this brilliant Chinese doctor Li Dongyuan, and he wrote one of the classics of Chinese medicine, which is the Treatise on Digestion, the Pi Wei Lun, which actually literally translates as the Treatise on Stomach and Spleen, but that's a slightly deceptive translation. So I prefer to say the Treatise on Digestion. There was a movement in Chinese medicine. This was written about 400 years ago. He had a real concern. Li Dongyuan, Chris, was just like you. So he was a guy, and he was from a wealthy family, and his father died terribly. And Li Dongyuan was so upset by this that he decided to become a doctor so that it would never happen to anyone else he loved. And he became an absolutely brilliant doctor. But what he noticed was that the doctors were using too many purgatives, and that their traditional formulas were too hard on digestion. And he recognized that digestion was at the core of all health.
Yeah.
So they didn't have the concept of bacteria and then microbes and so on. But what Chinese practitioners have always been preeminent at is observing cause and effect.
Yes.
And so have understood for a long time the absolutely fundamental importance of digestive strength. And what Li Dongyuan did was to take the formulas and reformulate them so that every formula respected digestion. So it's like your green juices with the ginger. In Chinese medicine, you'd never have the green juices without the ginger. And so the first thing we're talking, you have a formula. Say we've got a formula that has a lot of clear heat toxin herbs. Well, those are very cold herbs, very cold in nature, and digestion is a warm process. So we would never give someone a formula like that without herbs for digestion.
And I thought I invented it. No,
in scientific terms, what we're saying is many clear fire poison herbs or clear heat toxin herbs impact on bacteria.
Yeah.
So they have strong antibacterial properties. So what you have to do is add elements to support the good bacteria. That's basically what we're saying.
Yeah. Yeah.
Formula.
All right. So come on then. What are your 3 tips for everybody out there?
Well, the first one I mentioned. So that basically is find people with wisdom and integrity. And, you know, that can be quite to guide you. And that's easier said than done. I know many doctors who really care, but the information that they're acting with is very poor. And so understanding how wisdom and integrity integrate is really important if you want to get better. But I'm absolutely, after 20 years, I'm quite certain that people who live by that principle and who heal by that principle will have long and happy lives.
Mm.
My second tip is to be brave, especially in this day and age. You know, it's like everyone wants a piece of you these days, and it's the pressure is immense. You know, we're talking because they can get you on your phone, your email, social media, not just you, but the people who you're talking to and your family. And, you know, everyone's got an idea, haven't they? Mm. And it's all about influence. And I'm telling you that the majority of the influence in the modern world, they just want your money, and they'll do it in countless, incredibly subtle and destructive ways. So I say, be brave. And my third tip is be true to yourself. Mm. I think that a huge number of us, myself included, really don't know ourselves at the deepest level. I'm always there's that book. I forget the name of the book, of the common, is it the 13 common things that people who beat cancer have? It started as a PhD project, didn't it? And then there's a website now, and it's in your Sunday shows as well. And people always say, cut out the stress.
Mm.
If you get a cancer diagnosis, cut out the stress.
Well, I mean, Carol Sikora was interesting because I chided him and I said, he'd written a document for the World Health Organization. It was almost the first document I ever read on cancer in about the year 2001. And I said, and you left out stress as a cause of cancer. And the justification was, we can't measure it. We can't measure how many people, if you like, stress influenced, and as a result, they got cancer.
This is the point, Chris, that science is a blunt tool. We can't find all the answers with science. But what my point about my third recommendation is that it's not always that easy to understand where the stress comes from. And that's why we have to, I think, you know, I'm only just, I'm 46. I'm absolutely certain I'm only just working out where the fundamental stress came from in my childhood that absolutely lives with me. I just think it's so important for people to get to know themselves and to take that time and to be very honest with themselves about where the stress come from and their relationships. And that's real medicine. If you can work that out, it's real medicine.
I agree. So, George, how do people get hold of you? Do you want to do it through Chris Means Health, or would you like to say what your email is now?
Well, my email's on the internet anyway. I mean, if people just type in George Cooper Acupuncture Bristol or something like that.
Okay.
Website.
Will do, and I'll pass it on, and people can get hold of me as well.
Yeah.
Right. I don't know whether we covered it all, but I just want to say a big thank you. It's been really interesting. And it's very, very kind of you to give up your time. And it's a big thank you for me and all our viewers. And I think at this point, I'd like to also just wish everybody watching this a really happy Christmas and a healthy new year. I'm sure you would too. So I think that's it, really. Thank you very, very much indeed. And perhaps we'll see you again in the new year sometime.
Yeah, I look forward to it.
All right. Thank you. Very kind. Bye.